Hello, everybody, and welcome to our webinar. I'm glad you're here. And I'm always at home speaking to a group of massage therapists because this is my world, this is my life for the last 38 years. I'd like to welcome you to this webinar, to this question and answer session. Be thinking of your questions, anything about clinical massage therapy or this particular program, this online masterclass that we're speaking to you about today. And it ushers in the bringing of to any therapist that wants to be or is already in clinical practice, a really interesting program that brings you the essence of clinical practice because we follow the clinical model. And I'll go into that in a minute. I do like to start almost every talk by giving a bit of a definition, if I can, about medical massage therapy. So often people say, well, I've been doing massage for 10 or 12 or 20 years and say, what is this medical massage anyway? And it's not exactly brand new. The terms clinical and the term orthopedic and the term medical have been around a while. And as you may well know, many massage therapists seek to differentiate themselves from the regular massage therapy that others do to indicate that they're special. They have special training, they have special skills, they have a special approach, they have something that indicates that they're different. I know that many of you have seen the back of many therapists' business card where it'll say 8 or 10 different modalities that they're adept in, trained in, certified in, and eager to show that to their clientele. In this program, the word medical is an umbrella term. It seeks to cover the scope of the skills that we bring to the table. And yes, it is yet another attempt to separate ourselves from the pack of typical massage therapists. As you well know, our profession is divided into the spa industry, the wellness industry, the massage industry, and then the clinical approach with sports and with sports medicine and with clinics operated by doctors of chiropractic or physical therapists or MDs or other massage therapists. So the term medical is yet another attempt to differentiate ourselves from typical massage therapy. It indicates that we take a clinical approach, we follow the clinical model, and not unlike the term clinical or the term orthopedic. In every case, those teachers, whomever they may be, have sought to indicate that their program is special, more involved, more clinical, more involved with anatomy, physiology, and kinesiology than typical massage therapy. So that is the purpose of that term. It does not imply, I've heard it said, other proponents maybe of medical massage have said that medical massage is that which is practiced in a doctor's office or in a hospital or only for the purpose of billing insurance or only by appointment. And all of those things or anything typical that could be said. That may be the truth, but it doesn't have to be. In my experience as a sports therapist, I found that after I finished the Sydney Olympics in the year 2000, I'd been to the Atlanta and Sydney Olympics, and I began to really decide that I was going to begin teaching courses, and the decision to make was what to call them. Sports massage therapy, neuromuscular therapy, advanced massage therapy, clinical massage therapy, and the word medical came to mind in discussion with my colleagues, and that's the term that was chosen. And it turns out that has been a very wise choice in the sense that the growth of clinical approach in our field is really, really happening now. It's been happening for a while. It's been happening in my practice for the last 20, 25 years, and perhaps in many, many others as well. Now, many people are finding that out of massage school, they realize that they were not short-shifted, but they were given a routine treatment to do that's called a massage. And yes, I can give a massage, they will say. And yet that doesn't begin to cover the scope that we could possibly bring to this wonderful, wonderful profession that we share. And I wouldn't want to have any other job in the world. The opportunity to help people, the opportunity to change their lives through something that I've learned through many teachers and many courses and many trainings and many books is a joy to me and lets me sleep well at night and knowing that I've done what I can to help others in their health, striving, in their rehabilitation of injuries, in their recovery from terrible things like whiplash and accidents and all manner of sports injuries and overuse injuries. So our focus is to get results where we have not gotten results before.
David,
And
one of the things that has been changing in the massage world is this new position for medical massage as a specialty. Physical therapists have advanced their entire field into a 4-year postgraduate degree instead of a 2-year
true,
postgraduate
that's true.
degree. And physical therapists are really the only other profession that actually lays hands and does manual therapy. So
To soft tissue, yes.
that has left a real window, an opportunity for professionals as massage therapists to be in the medical field. And that's why this clinical model, this medical massage therapy, is of particular importance at this time.
Exactly. I agree completely, Sam. You know, when I entered profession in 1978, physical therapists had a 4-year baccalaureate degree, and then it became a master's degree, and now there are no more, to the best of my understanding, there are no more bachelor's programs, there are no more master's programs. All physical therapy studies are PhD. And I agree with you that in doing so, they have become physicians in a way who do differential diagnosis in their practice. In fact, I took a course from a physical therapist entitled Differential Diagnosis. So this is what they are capable of doing. And we, of course, as massage therapists, do not diagnose. We evaluate, we assess, and it gives us a wonderful opportunity to move even more securely into the clinical arena of medical massage therapy and use that clinical model of history, evaluation, and assessment, hands-on treatment, manual therapy, a wide variety of techniques, and then remedial exercise, hydrotherapy, documentation, and interaction with the other members of the clinical team. They might be physicians, they might be chiropractor, they might be physical therapists, they might be sports medicine specialists. So yes, it gives us many more wonderful opportunities to interact with clients in a clinical manner and giving them the essence of hands-on manual therapy that we know is important in the recovery of injuries, whether they be a sports injury or an overuse injury or an accident such as a whiplash or other types of accidents. So it really, the door is really flung open now for us to equip ourselves, to arm ourselves for that task. So I would invite anyone in the audience who is in clinical practice or who wants to be in clinical practice to know that this program is ideal for your next step to launch into the clinical arena. If you are working as an assistant in a as a massage therapist in a physical therapy or doctor of chiropractic office and clinic, then this is ideal for you to integrate with that professional, be they PT or DC or MD, and accurately interface with them on the level that they can understand what you're saying and vice versa. You have a common terminology that you use with all the work that's done, and it provides the basis from which you can expand your therapy, your approach, and become a clinical specialist. That is the formal approach that I take in my practice, and I'm simply relating to what I can teach to anyone that I've used in my practice with great results.
Well, and I can share with you and the room, so many of the comments that we've received back from students taking this course and doing, specializing in medical massage therapy, is that it really has enhanced their massage careers.
Absolutely.
People are, giving us the feedback to say that they are getting referrals that they've never gotten before. They get reactions from clients to say, "I have never had a massage like this,"
Exactly.
and they're getting bookings, and it really does allow you to specialize in that niche and take advantage of being able to serve people who are in need. It's not just a relaxing massage. This is a much more detailed program that allows you to really serve each client's needs individually.
Absolutely. Thank you, Sam. That's very valid and extremely correct. My essence of the whole practice is to get results where others have not gotten results. In fact, my typical favorite client would be one who has been to an MD for X-ray, MRI, had some chiropractic work, had acupuncture, had massage all over the place, and still doesn't have the results that they're looking for with that particular injury, that particular recovery of an ailment, a condition, obviously musculoskeletal. I don't mean fixing things that aren't musculoskeletal related, but rather the opportunity to do something that hasn't been done before has been my driving force for the last 30 years and more. So I fully relate to what you're saying, and you're exactly right. It opens the door. It opens the door for us to prepare ourselves to meet the challenge. And after all, the growing population is now the baby boomers are what, 65 or so, getting up there in years, having knee replacements and hip replacements and all of that kind of stuff. And we can be integrated into that work post-surgically in a very efficacious manner. We can be integrated into the work of recovering people, helping people recover from injuries, from ailments, and all kinds of problems if we have the right background. And I don't encourage people to forget what they already know. Rather, that forms a basis from which they can excel. I commonly use standard massage techniques in addition to all of the things that are taught. The idea of using a friction or a bit of a petrissage or some variety of techniques from classic Swedish massage, which was, after all, called Swedish gymnastics way back when, and exercise was integrated into it. So remedial exercise becomes a very important part of the work that we do because it needs to be a part of what we do. And I want you to know that we come from a place of using anything and everything that works with our hands. We use our hands in a wide variety of ways. And I want to say right here that I'm not a clone of any one particular approach. As you well know, many people will go out and study a certain technique, and then they will say that that's the technique they use. That's the approach that they take. And I want you to know that in my 38 years, I've studied a wide variety of techniques, and I want to incorporate, and I do incorporate them all into my practice. And everything I have in my practice, I show to you so that you can incorporate it into your practice. And yes, after teaching these courses since 2001, that's 16 years of experience, I have many numbers that I can call, pick up the phone right now and dial any number of people who have been in full-time clinical practice for 10 years and getting terrific results. We're hearing from some of them online as comments are made. Different ones have chimed in and said that, yes, I've taken these courses and that they're working for me in my practice. I'm getting results that I never got before. I'm saving my body. I'm working smarter than harder, and I'm going to last a long time. Some of the classic comments that I've had from students are that I'm 75 years old, David, and I believe with your techniques that I can last another 10 years. Those kinds of things are the things that warm my heart and give me great encouragement for the potential that is here for all of us. To know that a therapist who has been at it for 25 years, veteran therapists who have been at it for 20, 25 years and say that you have changed my whole approach. I was going to give it up. I was going to let it go. My hands, back, arm, fingers, thumbs hurt all the time. And I'm going to have to give it up. Clients are getting bigger. It's difficult to do what I've been doing. And I agree wholeheartedly because that's exactly what happened to me. I'm now 74 years old. I started when I was 36, and I'm still in there doing treatments differently than I did before, very differently, and yet getting good and great results. So we follow the clinical model, and yet in this particular course, which you won't see in other courses per se, you'll see the clinical model in other cases, in other courses, but you won't see the list and the growth, the expansion of techniques that we have in this course, and you won't generally see the scope and the change of adapting our bodies in such a way that we can continue to deliver magnificent therapy and yet change a variety of things. For instance, clothes on. working on a clothed client in a seated position with the table lowered down considerably, no oil and no thumbs. Now imagine that for a second. You're seated, you're not rushing around the table, whooshing and delivering that wonderful massage that you're struggling and striving to get done in the hour and a half or hour that you have to do that full body massage. And I'm right up to date with that because I just had one yesterday. A wonderful massage, and the therapist really struggled and strived to get through that hour and a half and hustle and bustle and all around the table and got a nice full body massage done. But I really wish that I had had more time on the areas that I had that needed work. And so many clients leave massage therapy and say, well, it was a nice massage, but they never got to my problem.
Your leg is bouncing the table. It's causing the screen to bounce.
Thank you, Sam. So, yes, I get excited when I'm talking to other therapists. There's no question about it. I'm evangelical about this work. I'm evangelical about the work that we are capable of doing. And we have...
One of the things that we wanted to show was the thumb saver. And talk a little bit about that work.
Well, there is a little history there, and we invite your questions, by the way. You know, I'll show the thumb saver right now, one of them. I only have one of them with me. This is the new one. This is the new small green tip, rounded edge. You've seen the bevel, you've seen the other large gray tipped one. And I want to say a big shout out to Paul St. John, my original teacher of neuromuscular therapy, all the way back to 1978. Who showed me some tools that were given out there in the seminars that they used to do the NIMO work. And what I've done is, I'll show it again, I've adapted it from a centerpiece that came up like this, way, way up there like that, where you could not even be able to touch it with your hand. And I have a rather large hand. So I moved it over here and placed it in there so that it just fits the hand just perfectly. Look how that fits the hand. Slight bend in the fingers, but very ergonomically centered. And I can do sustained pressure with that for a considerable period of time. And yes, my clients are getting bigger too, and more muscular, and certainly larger, whether it's muscle or not. And the opportunity to be able to provide sustained pressure to do the work that needs to be done. I don't mean deep beyond their capability of taking it. I mean sustained pressure of a moderate depth that we can use very effectively in our work to get the results that we're after. So I'm thrilled to have these tools to offer you the concept of no thumb work. When I stopped using thumbs, I continued to use the thumb savers because I can assure you that this tool in your hand against the body, with your hand resting on the body, and this tool into the muscle or into the trigger point, doesn't have to be just trigger point work. It can be a wide variety of applications of the thumb saver. So I want you to know that they come from an excellent history of being used in, and there are many NMTs out there who can relate exactly to what I'm saying, because they might recognize this as a cousin, perhaps, to the white tipped tools that they were that they got in their neuromuscular training with either Paul St. John or with Judith Walker. So I salute both of them as being effective in my training many, many years ago. And I use those teachings today to integrate that into the work that I do and the work that I'm presenting to you. I'm certainly not bashful as saying who I've been trained with. And by the way, speaking of that, I don't really seek to go through my resume and tell you what I've done or where I've been. You can do that easily on the website. And the website is www.therapyedu.net. If you'll go there, and at the top there are headings off to the left, instructors. Click instructors, and you'll be taken to my complete resume, not only the 38 years of massage therapy, but even the career and so forth before that. So if you want to check me out, and I do want you to see that, it's just that I don't want to take the time now to go through it with you. I want you to see what my background is and question me on it. Ask me, did you really do this? Yes, whatever's there is something that's really happened, I can assure you. And I'm very proud of my background, very humbled by the wonderful teachers that I've been able to study with over the years and integrate that into my teaching practice. So I'm eager to receive any questions you have about this clinical program. bring from your background, ask any questions you'd like, and we'll work them in as best we can and help you in any way with those answers. So fire those in now and let's see them, and we'll take that on and answer anything that we possibly can. Sam, do you have another question for me here?
Yes, how long should a typical massage session be? 30, 60, or 90 minutes?
That's a good question. There's no way to say that. There is no way to answer that except by that it depends on the client. I would say it depends on the client more than anything else. The age, the frailty, the severity of the injury, the time in which you're seeing them. Are you seeing them 3 days after an accident and you'll do very little and get just a few things done and then have them come back? So many variables. I have always worked about an hour, but so many people have injuries and things that require a little more time. I've spent an hour and a half many times. And I've also had some people come in and say that they are short on time or short on money. I've never turned anyone away. Someone said, I have $20. Well, fine, come on in. You'll get a treatment. You'll get something. I'll do something. It may not be an hour and a half treatment, but I'll do whatever I can to help you. So there's no way to make that judgment, Sam, and say that there's something that's best and something that's less than best. There are times when 25 minutes is plenty. Even more would be too much. I don't know about anybody else, but I have overworked a few people in my life, in my zeal, in my interest, in my effort, in my encouragement, in my excitement to get the results that they're after. I have overworked. It's only happened occasionally, I'll say. More than once or twice, though, I can assure you, especially early in my career, where I would overwork someone and have them come back and just be sore for several days. I say it's appropriate to be a little bit sore the next day, but I'd like to see that person on about the 4th day again, ideally, and we can add to what we've done before. So I'm looking for questions from you therapists out there, and I want to say that if you are injured, if you're a veteran therapist, if you've been at this a long time and wondering if you can continue at the level that you've been active at, I want to say to you to give this program a really good look. Look at my resume, look at the background of this program at the website as well, therapyedu.net. You can review the contents of each of the courses. You can see the list of pathologies that we cover. It is really impressive. The number of pathologies that we cover and teach you how to be effective with and to understand what they comprise and how you can be interfacing with others on the healthcare team. So our approach is to cover physical assessment and evaluation along with a wide variety of techniques. To list a few: trigger point therapy a la Janet Travell and Paul St. John, joint mobilization, pin and stretch, myofascial work, all manner of approaches that I've incorporated, and especially in the last 10 years, as I have truly set into aging, then I have made many changes in my approach. I don't lift people as much as I used to. I don't move them around as much as I used to. If you're younger and stronger, then moving people around is fine. Lifting heavy arms and legs and bodies and moving them is just fine. But in my dotage of 74 and after a back injury some years ago, I've modified my approach. Let's speak a little bit about the 5-month online masterclass. For this course, we have filmed courses for the last several years of live courses, and what we've done is post those videos, presentations, and demonstrations on a website for you to have access to 24/7. The course is completely self-paced. There is no time at which you have to ever be in class at a certain time. You can access the material. You can have access to the teaching staff through questions that you might ask on the chat at the website. You can see the answers that have been given to other people's questions, and you can pose your questions, and others will be able to see the answers that the teaching staff answers you with on your questions on the chat on that website for the 5-month course. Generally a 5-month course. You have access to the material for 18 months. If you need access that long, you can have it. And you do have it, and you can have it even longer than that if you need more access. Life gets in the way sometimes when we're taking an online course or doing anything of a longer nature of 5 to 6 months. So we understand that. We understand that life gets in the way sometimes, and we want to make that material accessible to you 24/7. You can decide when to go online and look at the material and study your tail off at your choosing of time. So that's the beauty of the course. The course contains all of the material that was contained in the live courses that I've presented over the last 16 years, traveling 8 states in the Western United States. And I invite anybody who's had courses with us before to voice those experiences that you might have had with our program, and also with the results that you're getting in your practice with your clientele. This course has met with a lot of approval from folks, and particularly the addition of the 4-day live intensive on techniques. What we've done is to give you 4 days with me, literally in a location hopefully near you, where you can come to the class with any questions that you have regarding the material, and we can iron out any questions or issues that you may have with material or with the application of anything that we've presented in the course. In addition, I get to show you many things that you haven't seen before. I get to show you the integration of treatment modalities, of techniques that go sequentially in the course, but in real practice, they're all combined together. The 4-day live techniques intensive gives us, the teaching staff, a chance to work with you and to help polish your skills and integrate all of the techniques and all of the approaches that we take into your practice and into your serving of your clients, by having all of that material available to you and integrated in a way that you can use it effectively in your practice. So the results that we've had, the reports that we've had from students, have indicated that they really value the 4 days on top of the online program. It gives them a chance to ask questions. It gives them a chance to see me physically at work on them and other students, and it gives me and the teaching staff a chance to come around and supervise and help you at the table, right at the table, so we can iron out any difficulties you have and help you polish your skills in a way that you can use it effectively, use all the techniques effectively in your practice. Following completion of the 72 CE Hour online program, you will receive a certificate of achievement. And in addition to that, following the 28-hour live techniques intensive, you will receive a certificate of achievement for 28 live hours of training. Since we are approved providers, all of our courses are approved by NCB-TMB for CE on the national level, and most states honor NCB approval. You might want to check with your state to ensure that your state accepts NCB-TMB approved courses, or if you need to seek a particular approval in your state. Registration is open for the next Masterclass, which starts November the 6th. You can follow the link that's associated with this video, and it'll take you right there where you can see all of the tuition information. We have payment plans for you available to make it easy for you to accomplish this goal. When you register for the online Masterclass, you will receive a package of materials beginning with this illustrated course manual containing manuals from all 6 of the live courses that I used to travel and teach. You receive a goniometer, a tri-measure for measuring the opening of the jaw. You receive a set of 3 of our thumb saver L-bars. You receive a set of 5 DVDs that cover all 5 of the technique courses that we've used for many years, and you have all of that material available to you during your study time. And you keep them, of course. In fact, you can download the online materials on the website into your computer and have them with you in your video library for the rest of time. So we invite your attention. We want you to look at this program very carefully, and if it appeals to your sense of being in and arriving at a clinical practice, then this course can be a very ideal step for you to take. Thank you for looking into this course, and we invite your attention. Reminder, course starts November the 6th. Registration is available on a link through this video, and we are eager to hear from you and answer any questions you may have about this program. We're proud to present it, and we're going to keep on doing so, and we invite your attention to it. Thank you. I'm David Morin for Health Matters Seminars.